my name's Laura and today I'm going to be talking to you about my role as a healthcare support worker. I've worked as a healthcare support worker for almost 16 years now. At the moment I'm working within the pain service in my local hospital and I work part-time. So I work 20 hours a week, which works out 2 full days and a half-day shift. The service I work in provides support to patients who are dealing with pain. So this includes working with a range of different people, from theatre staff, nurses, doctors, clinic setting staff, and basically we provide a service to help the management of pain that the patients are dealing with. So there's 2 sides to the pain team. There's an acute side which deals with all the patients in the hospital who are dealing with pain, and there's a chronic side which deals with people who are in the community who then come to clinic and they're dealing with chronic pain. So they could have back pain, leg pain, neck pain, and it's our job to just help them manage that to the best of their ability and to help them live their life in a normal way. And it's about helping them manage the pain so they're not feeling like they're living a life that's restricted. So my role as a healthcare support worker, I don't really work with the acute side. I'm more based on the chronic side. So when we have clinic sessions, I make sure all the clinic is set up. So all the patients' notes will come to clinic. I'll make sure they're all in order of the patient's times. I make sure the clinic area is clean and tidy. We've got stock, we've got documents that we hand out to the patient. I make sure basically everything's there so that session will run as smoothly as possible. I'll also, I've made some notes. So I welcome and greet the patients as they come. I provide reassurance to the patients because a lot of the time when they arrive, sometimes they've been waiting up to 2 years to come to clinic. So they can be experiencing a wide range of emotions. Sometimes they're really happy and relieved to be in clinic. Sometimes they're nervous about what they're going to get from our service. Are we going to be able to help them manage their pain? And it's just about understanding the patient, listening to them and just being a support for them, really. So when they come to clinic, the consultant normally carries out assessment of the patient, and this can involve a physical examination. So I'll just make sure everything's clean, the bed for the patient to lay down on, and I'll just be a chaperone to make sure that the patient's as comfortable as possible. I also help preserve confidentiality, and I make sure the patients are treated with dignity and respect, which I can vouch we all want to attend a consultation and be treated with respect. And I communicate in a politeful manner. And I also ensure the consultants have all the information needed. And then I accurately put the information into their notes, and then I send them all back to our medical records department. Another aspect of my job is when the patients come to clinic, sometimes they'll have trigger point injections. So if a patient's got really bad shoulder pain or neck pain, the consultant will carry out a procedure called a trigger point injection. And I'm just there as a chaperone and to just assist both the patient and the consultant as he carries out this procedure. Sometimes the patients get referred to theatre, so they'll have a procedure done, sometimes an epidural, and they'll have to come to theatre for that. When we run a theatre session, I'm there to meet and greet the patient, bring them into theatre, and then input information onto the theatre system on the computer. So I've just got to make sure everything's accurate and correct. So that's a little bit about the role. Working part-time as well as a healthcare support worker, it gives me a good family and work-life balance because I've got young children, so the job is really flexible around that. It also gives me opportunities to learn and develop my skills. So recently throughout COVID, I went to work in the recovery setting. So it gives me the opportunity to just learn different things. If you're interested in being a healthcare support worker, my advice would be to either volunteer to your local hospital and just get a gauge of what you enjoy, what departments you like, because there's so many different aspects to working in the hospital. Another thing you can do is go on Nurses.co.uk, have a look at their job opportunities, and also on the NHS jobs website. There's loads of different varieties within the hospital, and a lot of them are flexible around family life, which is really good for people who do have children. Also, looking online at different roles within other settings apart from hospitals. So, like healthcare centres, health parks, just the different areas. It's not just hospitals, there's community settings as well. So it's just looking at all the different varieties of care work which healthcare support workers work in, and seeing which one would work well with you and your interests. So yeah, I hope you've enjoyed this talk, and I hope it's given you some more information to help you if you are interested in becoming a healthcare support worker. And I look forward to doing some more videos. Take care. Bye.